There is a plant growing in the crack of your sidewalk right now that modern laboratories have confirmed can kill MRSA, E. coli, Pseudomonas, and Candida. For 3,000 years, it was one of the most important medicines on 3 continents. Today, most people step over it on the way to the pharmacy without ever knowing its name. In the next few minutes, you will learn exactly what that plant looks like, what is inside its leaves, why every village in medieval Europe kept it as their primary first aid remedy, and the strange reason modern medicine quietly forgot it existed. The plant is called Plantago major. In English, it goes by broadleaf plantain or greater plantain, and it has nothing to do with the banana you find at the grocery store. You have almost certainly walked past it today. Look for a low, flat rosette of oval, ribbed leaves pressed against the ground, with 5 to 7 parallel veins running lengthwise like the strings of a small green instrument. From the center rises a thin stalk topped with tiny green flowers and a spike of seeds. It grows in driveway cracks between paving stones, along curbs and gravel lots, and in the hard, compacted soil where almost nothing else can survive. It is one of the toughest plants on Earth, and it follows human beings everywhere we go. The Native Americans gave it a name when the European settlers arrived. They called it white man's footprint because the plant appeared wherever the colonists walked. John Josselyn recorded that name in 1672. The seeds traveled on boots, on wagon wheels, in the mud caked to livestock hooves. Within a few generations, it had spread across the entire continent. But the colonists did not bring it by accident. They brought it on purpose, because in Europe, this plant was already considered one of the most valuable medicines a household could own. To understand why, you have to go back 1,000 years before the colonists ever set sail. In the 10th century, the Persian physician Avicenna listed Plantago major in his Canon of Medicine, the most influential medical textbook of the entire medieval world. He prescribed it for wounds, for fevers, for coughs, and for bleeding. The Anglo-Saxons named it in the 9 herbs charm, ranking it among the 9 most sacred healing plants on earth. Chaucer wrote about it. Shakespeare wrote about it. Roman soldiers carried dried leaves of it on military campaigns, because when a sword cut you open on a battlefield in Gaul, this was what stopped the bleeding and kept the wound from rotting. The standard application was something called the spit poultice, and it sounds primitive until you understand what was actually happening biochemically. You picked a fresh leaf, you chewed it. Chewing was not symbolic. The act of chewing physically broke down the plant cell walls and released the active compounds locked inside. Then you pressed that wet mass of pulp directly onto the wound. It was used on cuts, on bee stings, on mosquito bites, on splinters lodged deep in skin, on infected scrapes, and according to centuries of frontier records, on snake bites. The swelling went down within minutes. The bleeding slowed. The pain dulled. American trail medics carried this knowledge through the entire 19th century, and then, in roughly the span of a single human lifetime, the entire tradition vanished. But before we get to how that knowledge was erased, you need to know what modern chemistry has actually found inside this plant. Because the science is genuinely astonishing, and there is one compound in particular that may change how we think about the future of antibiotics entirely. When researchers analyzed the leaves of Plantago major, they identified a small library of pharmaceutical-grade compounds. There is aucubin, which converts inside the body into a substance called aucubiginin that denatures bacterial proteins and essentially unfolds the machinery bacteria need to function. There is allantoin, which triggers cell proliferation and accelerates measurable wound healing. There is salicylic acid, which is the natural chemical precursor to aspirin. There are tannins that create an astringent effect, drawing wounds closed. There are flavonoids that provide antioxidant and anti-inflammatory action. There is ursolic acid, actioside, and a compound called plantamajoside that scientists only recently began to fully understand. In 2025, a team of researchers published findings that identified plantamajoside as a powerful inhibitor of an enzyme called Staphylococcus aureus sortase A. Now stay with me because this matters more than it sounds. Sortase A is the molecular tool that MRSA uses to anchor itself to your tissue, invade your cells, and build the biofilms that protect bacterial colonies from your immune system. Plantamajoside disables that tool. It does not kill the bacteria, it disarms them. This should make every infectious disease specialist on Earth pay attention. Because it does not kill the bacteria outright, it does not pressure them to evolve resistance. Conventional antibiotics work by killing, and killing creates evolutionary pressure. That pressure is exactly what gave us MRSA in the first place. A compound from a sidewalk weed is succeeding through a mechanism that pharmaceutical research has been chasing for decades. That is not the only modern trial. In 2022, the International Journal of Clinical Practice published a clinical study on second-degree burn patients. Researchers applied plantain extract directly to the burns and compared the results to silver sulfadiazine, the standard pharmaceutical treatment used in hospital burn wards around the world. The plantain performed comparably. Healing times were similar, infection rates were similar, and patients tolerated it well. A free plant growing in cracked pavement held its own against a pharmaceutical product backed by decades of research budgets. The plant is effective against gram-positive bacteria such as Staphylococcus aureus. It is also effective against gram-negative bacteria such as E. coli and Pseudomonas aeruginosa, and against fungi such as Candida albicans. It disrupts biofilms, and it carries anti-inflammatory and wound-healing properties that operate at the same time as the antimicrobial action. That means it can address infection and tissue repair in a single application. It can be identified by a child in about 10 seconds. So why is this not on the shelf of every pharmacy in the world? The answer begins in 1928 when Alexander Fleming discovered penicillin and accelerates through the 1940s when mass production made pharmaceutical antibiotics available to ordinary people for the first time in history. Almost overnight, plant medicine looked primitive. Medical schools quietly removed botanical training from their curricula, and pharmacology departments replaced herbal medicine programs. Doctors trained after 1950 had no exposure to traditional wound treatment of any kind. A 3,000-year-old tradition was forgotten in roughly a single generation, not because it stopped working, but because something faster appeared. But there is a deeper reason the plant never came back, even as modern science began rediscovering its compounds. And it has nothing to do with biology. It has to do with patent law. Plants cannot be patented in their natural form. No pharmaceutical company can own the exclusive rights to a weed growing in sidewalks on 6 continents. Without a patent, there is no path to recoup the cost of a clinical trial, and a single Phase 3 trial today costs between $20 million and $50 million. Pharmaceutical companies recover those costs through patented product sales over the lifetime of a drug. Plantain offers no such path, so the trials almost never get funded. The serious modern research that does exist comes mostly out of laboratories in Iran, India, and Brazil, where institutional incentives are different and traditional knowledge was never fully severed from formal science. Meanwhile, 3 generations of urban and suburban populations have grown up without any foraging knowledge whatsoever. Suburban lawns replaced gardens and wild edges. The word weed became synonymous with kill it. Herbicide. Companies built billion-dollar industries, spraying common medicinal plants out of existence on the assumption they were worthless. Schools stopped teaching plant identification. Hospitals and pharmacies became the only sources of healing that the modern mind even recognized. The knowledge survived only in scattered traditional communities, and in books almost no one was reading. You should know the honest limitations here. This is not a replacement for intravenous antibiotics during a serious systemic infection. If you have sepsis, you must go to a hospital. Most of the existing evidence still comes from in vitro studies and animal models, with human randomized controlled trials remaining limited in number. The plant compounds can interact with blood thinners and with lithium medications. Identification matters, because some toxic plants like foxglove form similar low rosettes, and you do not want to confuse them. Potency varies with season, with soil quality, and with which part of the plant you use. Standardization is genuinely difficult without industrial processing. None of this is a reason to dismiss the plant. It is a reason to learn it carefully. And here's the broader pattern worth sitting with for a moment. Penicillin itself came from a fungus. Aspirin came from willow bark. Morphine came from poppies. Digoxin came from foxglove. Roughly 25% of all modern prescription drugs trace their origin back to plant compounds. The pharmacy is still largely a botanical pharmacy wearing a different uniform. Plantain is not a strange exception. It is one example among thousands of plants that traditional medicine understood for centuries, and that industrial medicine has either forgotten or has not yet had reason to study. Every generation of lost knowledge weakens human resilience in ways that are difficult to measure until something goes wrong. And something is going wrong. Antibiotic resistance now kills roughly 1.27 million people across the world every single year, and that number is rising. So here is where we land. One plant grows in the cracks of every city on Earth. It performs the work of an entire small pharmacy without any patent, any owner, or any price tag. The knowledge of it was never truly lost. It was paved over. Traditional communities in Iran, in rural India, in pockets of rural Europe and Appalachia still use it daily. Modern science is now slowly, almost reluctantly, confirming what healers and grandmothers and battlefield medics knew for thousands of years. The next time you walk past a sidewalk crack, slow down, look at the ground. There is a plant down there with oval ribbed leaves and parallel veins, and if you learn to recognize it, you will start seeing it everywhere, in places you have walked 100 times without ever noticing. If you want to try this yourself, start by learning the leaf, the parallel veins, the rosette shape, and the central seed spike. Get confident in the identification before you ever use it. Then take a walk through your own neighborhood and count how many plants you find in a single block. You will be surprised. Share what you discover with someone who needs to know. The medicine has been there the whole time. It is only waiting to be remembered.